Choll here, room 3, on a sunny day in San Diego with lots of visitors. We're going to make sure that I do a good job because we have another very special patient all the way from Wisconsin. She is the president of a very large traveling nurse program. So yeah, she's a big deal. She's been hobbling around all over the place with pain because of this big disc herniation at 4-5 right there. You can see how it dribbles all the way down. It's occupying the right half of the canal, irritating the nerve. And she's miserable, weak, numb and tingly, and having a hard time with life and all the activities and demands therein. So we decided to proceed with surgery. She came all the way here so we can do the most state-of-the-art minimal invasive treatment for this that I have in my toolbox, called the LESS procedure, laser endoscopic spine surgery. We use a little poke hole and endoscope underwater. We'll go into the natural opening on the side, this narrow femoral opening right here. We'll reach in here, we'll pluck out that disc herniation, we'll make sure that the nerves are free, make sure there's no loose disc fragments within the disc space, control any bleeding, and restart the new healing process and get her back to her busy life, because she has a very important job in this world to keep the ORs and hospital staffed with awesome nurses. So, wish me luck. Alrighty, I drew all the perfect lines, created what I thought was a perfect entry point, confirmed it with the 18-gauge needle, and then once I confirmed it, I did a little stab incision. Now I'm going to use the spaghetti needle dilator to get it right to the surgical target site. And I'm going to stick my pinky out. Okay, I've got the spaghetti needle dilator at the surgical target site. And I stuck in this tiny little needle into the middle of the disc. I injected the dye and it's leaking out the back. And you can see it outlining the disc herniation already. I think that is just adorable. I'm sorry. That's it. It's leaking out like crazy. Because there's a big angular defect I suspect. Okay, this is almost the first look. It was all red and inflamed and ugly in here. So I'm just getting started. There's the disc. Sort of went in, so that doesn't count. But see how I cannot easily get in here? I'm going to basically reduce all this down. This is the canal inside here. I should be able to just fall in here. And by the end of the case, I should be able to. Okay, here's Wagner's Arch, after Ralph Wagner, German speed skater, retired, and German endoscopic spine surgeon. So, this is the pedicle. Complement this particular process, and I should be able to just fall in here and wrap around the pedicle on x-ray now. It's blocking me, it's stuck, and there's a disc herniation right there. X-ray? So now I know exactly where everything is. Because I'm good enough, yes, I'm smart enough, God's got it, parents love me.
And young people.
And young people. Okay, so here's the acne nerve root right there. Look away. There is the entry point to the canal. X-ray? Yep. And then the disc herniation is right here. I can feel something, it's blocking me. Right there too. It's all stuck down as well. In case you're wondering, is it the real thing or is it just a gimmick? It's like my car. You don't need a 577 horsepower car, but sometimes you do. You don't always need a laser, but sometimes you do, and sometimes it's nice to have, even though you don't need it. There she is. I think some of the soft part of the disc herniation resorb, but we'll see. It's going to be like my teenage kids. It's not going to come out in one big piece. It's going to give us trouble, resist us, and torture us, make us feel guilty about whatever it is that we did parenting-wise, and then it'll eventually come out. That's what I think it's going to be. So I'm ready for it. The really, really dark blue is the nucleus. Like this light blue stuff, that's all we do. There's something right here, right there. Oh, so annoying. Oh, man. A little mouse! So cute. Okay, so remember when I first started, this was just a wall of tissue? Now look at it. What? Turning in. Look how floppy that disc herniation is. X-ray? Yep, that's exactly where I need to get to. One shriveled down south. X-ray. Feels good. X-ray. Save all these. Feels good. It's called a Mikey fragment. If the fragment comes out, if you think you're done, you're like, oh, I feel something right there. Look at that bead. And it's like, Mikey walks in. He goes, are you guys almost done? It's like, no. It's like, oh my God, look at that piece. This is the Mikey fragment. it's gonna be big. It's a girl. Poor thing.
I didn't have any problem. This all happened after I got
I know, we've got some issues here. We're not normal. Strip people naked, render them unconscious, and assault with a sharp instrument all day long. You think like discriminations are the world's greatest. No, true. Keep on giving.
This is a giant family.
Started eating and
Yeah, we knew that though. Could have just come out in one big piece, but no! No, that would be way too easy, especially with the visiting surgeon. He wants to see me struggle. In my final check, there's the traversing nerve root. This is where the disc herniation was. You're bleeding on me after all I've done for you. Come on. Oh yes, the surgery's all done. I did a little focal, and I don't know about you, but I was working hard to get multiple pieces out. I think I broke a nail, but the surgery went perfectly, and we're all hoping for a great result. Right, guys?
Yeah!